My name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 16th of March 2022. In terms of COVID inpatient numbers, they're pretty much the same as last week. We have 73 patients showing on our system today, 68 patients in general and acute beds, 4 at Clifton and 1 patient in critical care. We've also shown 6 further deaths this week of patients who are within 28 days of their first diagnosis of COVID. So as ever, my commiserations and thoughts go to the family and loved ones of those involved. The community numbers are rising a little bit, which is of some concern. So today the figures are 377 per 100,000 for Blackpool, 361 for Fylde and 393 for Wyre. We were towards the low 300s last week, so this is a not insignificant increase. It impacts partly in terms of staff sickness, of course, and I think that's across the whole health economy. So out in the community, health and care workers, we're seeing some sickness rates increasing, which of course puts pressure on the system. It reminds us how important testing is, and lateral flow tests are still free from the pharmacists or online until the end of March. So I would still encourage anybody who feels they have symptoms of a cold, flu-like illness, which could be COVID, to do a lateral flow test and check, and then if that is positive, to think about getting a PCR test, which is of course confirmatory. That's not legal, it's not law for everybody to do that, but I think it's still very good practice, and that's where we're picking up these increased numbers. Within the hospital, we use a system called LAMP, which is in fact a little bit different to lateral flow. So our staff, it's a sputum sample rather than a swab. But at the end of this month, we will be switching off the LAMP system, and all of us will be moving on to using lateral flow tests. Just to make that point about if you're coming to visit relatives or loved ones in the hospital, it's good practice, it's best practice, let's put it that way, if you could do a lateral flow test before you come in, because there is a real risk of spreading COVID across the hospital. And of course we'll ask you to wear a mask when you come on site and abide by our infection prevention and control measures. I mentioned last week that I anticipate that there will be a booster program, another booster program for everybody over the age of 75 and other patients in at-risk groups. We still anticipate that happening. I'm afraid I've got no further detail at this moment, but I think we'll look out for that and anticipate that that will start in April. We're going to keep our vaccination hub open for the foreseeable future. So there is capacity for anybody who's not up to date with their vaccinations for COVID to get them, and as you know, I strongly advocate that because the evidence is compelling that is the best way to reduce personal risk and to support our communities in reducing community risk. So the hospital and the NHS remains extraordinarily busy. We've seen really very, very high numbers of patients coming through our emergency department, and that has led to quite a lot of delays and queuing, for which we apologise, because it's quite obvious that that's not how we want to run the system. But the pressures have been enormous, so I need to ask that people are very thoughtful about coming and using the emergency facilities, and there's a usual escalation around self-care, around accessing information from pharmacists, from the 111 system and from general practice, and really only using the emergency system for emergencies. I'd really like to pay tribute to all our colleagues working in the emergency department and also in the ambulance service, who just carry on tirelessly and professionally delivering the best possible care they can, despite obvious pressures in the system. If you do come on site, you'll notice there's a lot of building work going on at the moment, and there's a couple of things to say. We are, of course, redesigning our emergency department, and we're building a new critical care unit, and we're also now putting on site a new 24-bedded ward to increase our capacity, partly so that we can maintain all the surgical work, which got a little bit backlogged through COVID, but also to help with these patient flow issues that I've described. So by the summer, we'd expect to be opening some improved facilities for emergency care and our new critical care unit. But the full programme, which is on time and target and budget, is due to open fully and finally in the summer of 2023. So there'll be quite a little bit of building work going on in the interim, and some moves and some temporary facilities. But by the time we get to summer 2023, we should really have some wonderful new facilities that make the environment better for our staff, of course, and also for our patients. So we hope to minimise inconvenience along the way. Thank you very much.